Welcome back to Empowerment Nursing. I'm Ashley and I am a nurse educator, and you are tuning into our weekly application of In the Know, where we make it simple. Today we are applying our Facebook Live, ways to use your body to come to the right answer. If you didn't catch our live, you can always tune back into this later and go catch the replay. Lots of tricks and tips about how you can use your own body to get the right answer on the registration exam. So here's our question for this week. The nurse is providing education to the parents of an infant who has undergone surgery for a cleft palate repair. In which of the following positions should the nurse teach the parents to position the infant upon discharge? A, supine position, B, side-lying position, C, prone position, or D, Fowler's position. So let's think about this. The baby has had a cleft palate repair. The palate's on the inside of the mouth. So are the sutures on the outside of the mouth? No, they're not. The sutures are on the inside of the mouth. So because the sutures are on the inside of the mouth, we can place the baby, correct answer, C, prone, meaning on the stomach, to promote drainage from the mouth. So C is our right answer. Note, this is very different from a cleft lip repair. When a baby has a cleft lip repair, there's sutures on the outside of the lips. So you cannot place that baby prone because you will put the lips right against a surface. So after a cleft lip repair, the baby has to be positioned either supine on the spine or side lying. So thank you so much for tuning in to this week's application of In the Know. And for the answer to this question and more, and for all concepts simplified for your registration exam, check out our complete study package, which we just announced last week, now comes with a money back guarantee. I will see you next time on In the Know. Bye for now.